Hi, my name is Lisa Hatfield, and I'm a myeloma patient. I was diagnosed back in 2018. I am an empowerment lead at Patient Empowerment Network. And one of the things that we are frequently asked is, what are all of these letters and acronyms when we are diagnosed with myeloma? So just in a nutshell, this is why myeloma is so complicated and confusing based on my story. So I was diagnosed, like I said, back in 2018. I have kappa light chain only myeloma. When I was a newly diagnosed myeloma patient, which is NDMM versus RRMM, which is relapsed refractory multiple myeloma patient. I have kappa light chain only myeloma. I have, and I'm just going to spew out all of my letters and numbers. I have translocation 1114. I have monosomy 13. I don't have an M spike, which means all of my antibodies are normal. My IgM, IgA, IgG are normal. After I had surgery and radiation, I went through 6 months of KRD, followed by another 3 years of just the R, which is Revlimid. Every month I have, in addition to my myeloma labs, I have a CBC, a CMP. Every year I have something called a BMB, bone marrow biopsy. I have a PET CT, an MRI every year. And then I do something with my bone marrow biopsy to check for something called MRD status by NGS, which is currently I'm MRD positive at 10 to the -6. So all of those letters it's just a big alphabet soup for people to try to understand myeloma. It gets really, really confusing. One of the things as a myeloma patient that I recommend to people is the IMF, the International Myeloma Foundation, just to add a few more letters to it. You can look at their website at myeloma.org. They break down each of these phrases and words and letters and acronyms and whatnot. So newly diagnosed patients and patients who have had myeloma for a while can understand all of these letters and all of these numbers and what these genetic mutations mean and what the tests mean. So I guess, Sujata, I know you've been through this too, and we're just having a conversation. How did you, when you were first diagnosed, I'm curious too, and for other patients, how did you get through all of the letters and things being thrown out at you?
Yeah, Lisa, this is funny. So my name is Sujata Datta. I'm a board member at the Patient Empowerment Network, and I'm also an MM patient. I was diagnosed with multiple myeloma in December of 2019. And Lisa, you summed it up really well. This alphabet soup is actually a real thing. The first time when I got to know about it, I actually, obviously, like many folks that I have known that are on this journey, it comes up as a surprise. It just is, for me, it was interception. I can actually say that word and spell it, I think. But at the time when I was diagnosed, I had no clue what the doctor was talking about. I had this massive inflammation of my lymph nodes, and I had to have like emergency surgery because the lymph nodes had caused damage to my big intestine. And then we did some research, we as in the doctors, and after a week post that surgery, I was diagnosed with multiple myeloma. Again, I can say that today, but when they told me about multiple myeloma, I'm like, I have no clue what you're talking about. They had literally had to dummy it down and say, this is a kind of a blood cancer. I'm like, oh, cancer. All right, then. So the alphabet soup is actually a real thing. I do have M spike, Lisa, unlike you. My kappa light chains are fine, and it's been a long journey. I'm not there yet, so still, my goal is to achieve MRD or remission. I'm not there yet. I still have a involvement through my proteins, not so much in the bones. So let's break that down a little bit, Lisa. Let's talk about that alphabet soup and, how do you navigate that through as a new patient? I would say not even a new patient, like an existing patient like me. Sometimes I'm like baffled, like, oh my gosh, like what is this report saying to me? So thanks for sharing that resource about IMF. But what else? Like as you started, just think about, those early days, weeks when you were diagnosed and all of these terms were thrown at you. How did that feel and how did you overcome some of it, if not all?
That's a good question. So I went in to see my local oncologist here after I had gone through radiation surgery down at MD Anderson because I was going to have my chemo here. And in his office, there was a poster up for a local myeloma support group, which I was not excited about. I thought, well, maybe I'll go, but I don't want to I already feel down enough I'm already overwhelmed enough with my diagnosis. But I called the lady, her name is Sherry, called her up. We talked about myeloma. She'd had myeloma for 7 years, and I was super inspired by that. So we showed up I had a walker. I had to walk with a walker because of all the damage to my spine, and showed up kind of limping along with my walker. And everyone there was talking about, oh, you're newly diagnosed. What is your M spike? That was something new that I hadn't heard. And I hadn't had that discussion with my doctor. I didn't realize at that time it was because I did not have an M spike. So I think like you said, it's overwhelming enough to just receive that diagnosis. And in my mind, I remember thinking back, okay, if I talk to a new patient, if I can get through this and make it a few years out, what are the things that were the most confusing to me? And I think understanding the type of myeloma, if I were to recommend, like patients were to ask me, understanding the type of myeloma a patient has, the genetic mutations, and understanding what their M spike is or is not, if they are just if they're light chain only, if they have light chain only disease. Those would be the things I think, because it is so confusing to
Yeah,
patients. And then I think as they go along, maybe they can ask their team, well, what does that mean? Or what do those letters mean? And it's
yeah.
okay to ask those questions.
Absolutely. Ask as many questions as you can. You are encouraged as a patient to ask questions, or at least I was. I think what is also important to note is like with MM, it's a very individualized sort of a disease. So although we put it under the bucket of like multiple myeloma, everybody experiences it differently. They even have reactions to medication very different. Like just yesterday, I was talking to somebody in my support group, and they had a really different experience to one of the drugs that I take regularly, daratumumab, every 4 weeks. She just had the first dose, and it was such a bad reaction, she ended up in ER. So
Oh,
not scaring anybody, but I'm just saying like everybody has different reactions. Somebody might take to some medication really well versus others may not. And just between the two of us, we have different, like I've got M spike, you don't have that. And, so there are these nuances, which I think it's just important to acknowledge. There's nothing to be scared of. It's just, like acknowledging the difference of how multiple myeloma works versus some other cancers, maybe. I think it's important. And you brought up a good point about, trying to understand the labs. We don't have to be experts. I don't think I want to be an expert. I have folks that are experts that will take care of me. But just so that I understand the basics of it, and then I'm able to ask questions for my own self.